So we're doing combination treatments today for my beautiful patient. First, we're going to start with a Trifecta Radiofrequency Microneedling and then follow with neuromodulators after. Typically, I combine treatments for my patients, especially for those that are wanting to look youthful without significant downtime. Okay, so we do non-surgical, non-invasive procedures here. So Trifecta RF Microneedling, we're the only one in Oahu that does this. We combine the technology of radiofrequency, which we all know now is good for skin tightening, and with that is a gadget with 36 microneedles. It sounds intense, but really she's numb, so she should be okay today. So what it's doing is the microneedling, we know that too, is creating micro injuries to the skin, tail, produce collagen, but the good thing about it is the radio frequency is delivered straight down to the dermal layer where dermal remodeling is happening. And with that, the cherry on top is the peptide factor, which is a growth factor, which also accelerates the healing time and also for collagen renewal. All right, so like I said, she's completely numb. And it's not her first time. This is actually her favorite treatment, right? Because we really do see results here. And let's show them the tiny needles. So those are the tiny needles, okay? Alrighty, test spot. So little flinching, meaning to say that she's okay. She's still feeling something. Everything here that I do at Ali Inani, you have to feel something, but I try to make it comfortable for my patients. So for this, I apply topical numbing, but otherwise, it's a good, well-tolerated procedure. How is it going?
It's good.
So we treat the entire face for this procedure. We're doing 50% overlap. This also helped with her acne scars. So the discomfort is really the heat, right? But the tiny needles, I would say, not as bad. So the redness will subside case to case. Some patients, maybe after a few hours, some maybe about a day or two. Now I suggest after your treatment with this RF microneedling, laser, anything that has to do with micro injuries to the skin, as much as possible, schedule it on a day that you are not going anywhere, that you have to wear a mask. And the reason is we're just trying to avoid breakouts or skin irritation. But if you're acne prone, and you're doing this kind of treatment, you just spot treat in the event of breakouts. This is good for textural issues such as wrinkles, fine lines, scars, pore reduction, and this is a good complementary treatment to all the injectables that we're doing here, or I do here with my patients. So we can combine this with sometimes with facials too, like dermaplaning or microdermabrasion to prep the skin, especially for my patients that never had any procedures done, so that we can optimize the results. And a little red, but overall you're good, right? Okay, now we're done with the first step. What I'm doing now is the application of the peptide factor. So remember, we created micro channels, right? So this one is infusing the growth factor, so she heals fast and also helps with collagen renewal, okay? So I say this is like the cherry on top. It feels good on the face, right? After the heat, it's very soothing. And you will notice that your skin will also look glowy, brighter after this treatment. Give it like a few days. How often you do this procedure is really dependent on your skin concern, okay? In general, if you're working on textural issues such as scars, then minimum of 3 to 4 sessions spaced out 4 weeks apart. And after that, I would say maintain every 4 or 6 months. Okay, that's what I do for me personally, so that we can consistently see results. As you know, we all age, right? So we cannot really stop the time, but we can delay the signs of aging by doing treatments like this. Okay, so part 3. Now we are going to be doing her usual neuromodulator injection. Okay, so she doesn't need a lot because she's also good in maintenance. So we're gonna just be giving her baby doses this time. Okay, the forehead. Relax. Lift it in. Relax. Oops. Right there. As with any Botox injection, in case you bruise, ice pack. Okay, but what you can do to prevent is, on your side, from the patient's side, if it's not contraindicated, try not to take aspirin or any blood thinner, vitamins, fish oil at least a week before your appointment, and don't drink. A lot of times I have patients before coming, they drink like the night before. Well, it's not a bad thing, but I'm just saying, if you don't want to bruise, because every time we poke, there's always a tendency to bruise, right? It's no BD for a lot of benefit. Right. Okay, lift again. Relax. And one last. Relax. There you go. From. And then we're going to be doing lift, which is her favorite procedure too. So a lift is just tiny doses of Botox. I'm using Xeomin for her. It's not going to replace a true lip filler, but it just gives you that illusion of fuller, just because we are relaxing the top muscle. It gives you more of the pink show. Yeah. First for me, like straw, drinking from a straw. Okay. Relax. So the lip is just, you know, very sensitive. That's why. Again, beauty pain for a lot of beauty gain. Sensitive part. That's the only thing.